Hello everyone, I am Dr. Akhilesh Kumar, Consultant Physician, Wellness Hospital, Amirpet, Lal Baglo. So in my previous video, I have discussed to you about one of the major pandemic that is going on in India, that is diabetes. So today we'll have an insight about another major pandemic which has been overlooked, that is hypertension. There is a saying called rule of 10 or percentage of 10 in hypertension, which states that only 10% of people who are actually hypertensive are diagnosed with hypertension, and only 10% of the people with hypertension are receiving treatment, and in that 10% of people are receiving adequate treatment. So hypertension is a slow pandemic. That is because most of the people, even if they are hypertensive, it takes a long period of time before they realize that they are hypertension. So what are the reasons? What are the symptoms when you should suspect you are hypertensive? First, if you are having continuous headache, or if you are having intermittent headache. Second, if you are having recurrent episodes of syncope. Third, if you are having palpitations. If you are having palpitations, if you are having headache, if you are having recurrent syncope, then you should suspect yourself for hypertension, and you have to check your blood pressure. And what are the category of patients that should always screen themselves for hypertension? The first category is if you are obese, if you are having a sedentary lifestyle, if you have family history of hypertension, and if you are already known diabetic. Always screen yourself for hypertension. So screening, in the sense, what I mean to say is that most of the people, when they approach their doctor for screening of the hypertension, they find that their blood pressure is normal or slightly higher, and they don't subsequently check it. The screening is actually for hypertension is different. You need to have home-based blood pressure monitoring. You have to monitor your blood pressure at home at least twice in a day, morning and evening, and if possible in the afternoon also. That is because there is diurnal variation of blood pressure. The blood pressure, the 120/80 blood pressure is normal, we say, that is not static for all the time. So at morning your blood pressure is relatively lower, and at evening your blood pressure is relatively higher. So the difference of 5 to 10 mm of Hg in systolic and 3 to 5 mm of Hg in diastolic is anticipated when you measure the blood pressure two separate occasions. And if you're screening yourself for hypertension, make sure that you record your blood pressure at least 3 consecutive days, so that you get a 6 recording chart. And in this 6 recording chart, if your systolic blood pressure is more than 135 mm of Hg and diastolic blood pressure is more than 85 mm of Hg on at least 2 occasions, then you take up upon yourself to consult a physician and start off the treatment for hypertension. These are the key mantra to control your blood pressure and maintain a healthy body lifestyle. Thank you.